Dr. David Wickman with Breakaway Deep TMS and Psychiatry is now joining us live from our remote studio. Dr. Wickman, good morning.
Good morning, Erin. How's it going?
You know, it's going pretty well so far. It is a Monday, though. It has been a pretty difficult year, as you know, and when you think about the pandemic, changing seasons, changing our holiday traditions, how does all of this affect mental health?
Well, normally, in a normal year, this is the time that we start seeing lots of issues coming through the office of seasonal affective disorder. And it's with the time change, with the days getting shorter and daylight hours getting less. It's very normal this time of year to start having some of those seasonal affective or winter blues things start affecting patients. This year is very unique in that, along with the normal swing of moods for people, we have all of this stress that you just mentioned with all of the COVID-19 changes in patterns, changes in work patterns, school patterns, how we're going to celebrate the holidays coming up. It's just causing a lot of issues that can pile on people and cause lots of depression feelings this time of year.
Oh, and that's what I was going to ask you. Is seasonal affective disorder the same thing as depression?
Seasonal affective disorder is depression. We treat it just the same as we treat depression. It's kind of a fancy name given to a cycling mood disorder that happens with the seasons. And it's generally coming into the fall and winter periods, having those increase in depression feelings. There are some unique things that we do for seasonal affective disorder. A lot of it is triggered by the changes in light and changes in the sun. And so light box therapy, vitamin D, treatment are some of the things that we do specifically for seasonal affective that are a little bit different than just depression. But it also it's depression, and we treat it the same with the same medications and the same treatments.
Is there anything that people can do at home?
Yeah, I mean, the big thing is talk to your primary care physician. A lot of people will do a little bit of extra vitamin D supplementation this time of the year to try to help with some of that loss of sunlight during the day. Light box therapy is something that we routinely prescribe, and that's getting in front of an actual full spectrum UV bulb, like one of those plant bulbs that you can grow your plants in your house with in the wintertime. Getting in front of one of those light bulbs, 10 to 15 minutes, 2 to 3 times a day can actually help as well for the seasonal affective disorder.
Well, Dr. Wickman, how can people reach out to you if they have more questions?
The big thing is to actually just keep track with your loved ones this year. If you can't see them in person, Zoom with them, Skype with them, and check in with them and see how they're doing. If they are struggling a lot, or if you're struggling a lot, there are lots of professionals available to you. To get a hold of us would be just to pick up the phone and give us a call at Breakaway, or go online and fill out one of those intakes that we have online and come and get seen. Most places now are doing telehealth appointments. We're also still doing some in-person appointments right now too. The biggest thing is, if you are finding yourself struggling or finding somebody else struggling with depression this time of the year, is reach out and we're here to help you.
All right, good advice for us. Dr. Wickman, thank you for being with us today.